वेलकम टू माय चैनल। आज हम कंटिन्यू करेंगे क्वेश्चन नंबर 51 से 100 तक PGPCET 2019 के MPT एंट्रेंस के क्वेश्चन आंसर्स को। लेट्स गेट स्टार्टेड। लास्ट वीडियो में मैंने क्वेश्चन नंबर 50 एंड 51 के आंसर्स आप लोगों पे छोड़ दिए थे। फिर भी मैं अपनी तरफ से मैंने जो ढूंढा और मुझे जो मिले ऑप्शंस करेक्ट जो भी हैं वो मैं बता रही हूँ। दैट क्वेश्चन नंबर 50, बैड प्रोग्नोस्टिक फैक्टर इन ल्यूपस नेफ्राइटिस इज परसिस्टेंट proteinuria, and for question number 49 that was a tumor plop. I hope you will relate and correct the answers if you were wrong, and अगर आपको अपना आंसर सही लगता है तो आप कमेंट में जाके डिस्कस कर सकते हैं। I will surely comment your answer. Okay, so question number 51 हम 51 क्वेश्चन नंबर से स्टार्ट करेंगे। लेट्स गेट स्टार्टेड। क्वेश्चन नंबर 51, ट्रांसफ्यूजिंग ब्लड आफ्टर प्रोलॉन्ग्ड स्टोरेज कुड लीड टू। ऑप्शंस आर citrate intoxication, potassium intoxication, circulatory overload, hemorrhagic diathesis. Correct option is potassium intoxication. Question number 52 is, in facial palsy, food accumulated in the mouth due to paralysis of. Options are masseter, temporalis, mentalis, buccinator. Correct answer is buccinator. Question number 53, earliest valvular lesion in a case of rheumatic fever is. Options are mitral regurgitation, aortic regurgitation, mitral stenosis, aortic stenosis. Correct option is mitral regurgitation. Question number 54, all are seen in ARDS except. Options are pulmonary edema, hypoxia, hypercapnia, and stiff lung. Correct answer is stiff lung. Question number 55, ovarian cycle is initiated by. Options are LH, FSH, GRH, and estrogen. Correct answer is follicular stimulating hormone, which is FSH. Question number 56, in prima gravida, during active phase of labor, the rate of cervical dilation per hour is. Options are 1.2 centimeter, 1.5 centimeter, 1.7 centimeter, and 2 centimeter. Correct answer is 1.2 centimeter. Question number 57, contraindications to use of oral contraceptive pills are all except. Options are breast CA, kidney disease, smoking, and liver disease. Correct option is kidney disease. Question number 58, a weak and painful contraction on isometric assessment of contractile structure indicates. Options are tendinitis, partial tear, complete tear, neurological involvement. Correct option is partial tear. Question number 59, the supply to the following region of the tongue will be affected by a facial nerve palsy. Options are anterior 2/3, posterior 2/3, anterior 1/3, or posterior 1/3. Correct answer is anterior 2/3. Question number 60, obesity, diabetes, and hypertension together present as. Options are metabolic disorder, hypermetabolism, metabolic syndrome, and hypometabolism. Correct option is metabolic syndrome. Question number 61, an objective measurement of the extent of edema can be brought about by. Options are gravimetric measurements, palpatory analysis, observatory analysis, and volumetric measurements. Correct answer is volumetric measurements. Question number 62, a large amplitude mobilization which reaches the end range is referred to as dash Maitland technique. So options are grade 1, grade 2, grade 3 or grade 4. So correct option is option number D, grade 4. Question number 63. When there is a significant base deficit, the appropriate terminology is, so options are acidosis, acidemia, alkalemia and alkalosis. So correct answer is acidosis because base deficit है, so acidosis. So question number 64. The ULTT3 is a test that is biased towards which nerve? So options are median, radial, axillary and ulnar. So correct answer is D, ulnar nerve. Question number 65. A Faraday galvanic test is performed to assess. Options are tendon continuity, nerve continuity, connexity, Rio base. So correct answer is tendon continuity. Question number 66. The following movement restriction needs to be imposed in the case of a total hip replacement with a posterior lateral approach. Options are hip flexion beyond 90 degree and abduction, hip adduction and internal rotation, hip extension and external rotation, and hip flexion to 90 degree and external rotation. So correct answer is hip adduction and internal rotation. Question number 67. Closed chain exercises are helpful following an ACL reconstruction surgery as they, so options are offer compressive forces, increase shear stresses, eliminate co-contraction of muscles and offer proprioceptive loads. So correct answer is offer proprioceptive loads. Question number 68. Presence of the scoliotic curvature in the standing position and not in sitting could be due to, so options are unilateral gluteal atrophy, congenital segmental bar, limb length discrepancy and unilateral rib fusion. So correct answer is limb length discrepancy. Question number 69. MET technique of post isometric relaxation to the triceps will help to increase. Options are passive elbow flexion, passive elbow extension, active elbow flexion and active elbow extension. So correct option is option number C, active elbow flexion. Question number 70. The mainstay of management of phase 3 periarthritis of the shoulder is, so options are pain management, restoration of scapulohumeral rhythm, strengthening of the glenohumeral muscles and mobility of scapulothoracic joint. So correct answer is strengthening of the glenohumeral muscles. Question number 71. Inability of a patient to perform active abduction at the shoulder in the absence of a neurological involvement may indicate. So options are capsular restriction, ligamentous instability, muscular tendinitis, muscular tear. So correct option is muscular tear. Question number 72. The following is the most common long-term complication of a stress shielding device used to fix a fracture of a long bone. So options are decreased mobility of the adjacent joints, reduced weight bearing capacity of the bone, decreased strength of the surrounding muscles, and option D, non-union of the fracture. So correct option is decreased strength of the surrounding muscles. Question number 73. Flexion biased exercises are preferred in a patient with spinal canal stenosis because, so options are they have a stabilizing effect on the spine, they are functional in nature, they cause a decrease in pain, They increase the neural canal diameters. So correct answer is they increase the neural canal diameters. Question number 74. The initial phase physiotherapy management of a patient post TKR focuses on preventing following complication. So options are knee flexion deformity DVT, atelectasis, and tendoachilles tightness or TA tightness. So correct option is DVT, option number B. Question number 75. The type of exercises that should be administered in a patient with osteoporosis is. Question number 75 के ऑप्शंस हैं साइकिलिंग, हाई इम्पैक्ट वेट बेयरिंग, लो इम्पैक्ट वेट बेयरिंग एंड स्विमिंग. सो करेक्ट आंसर इज लो इम्पैक्ट वेट बेयरिंग. Question number 76. While conducting EMG studies, the characteristic picture at rest in normal subject shows. Options are small action potential, electrical silence, positive sharp wave, fibrillation potential. So correct answer is electrical silence. Question number 77. Vertigo is seen in a lesion of. So options are fourth cranial nerve, fifth cranial nerve, seventh cranial nerve, or eighth cranial nerve. So vertigo is seen in lesion of fourth cranial nerve, which is also known as trigeminal nerve. Question number 78. The ability to integrate information from environment to produce movement is. Options are stimulus identification, sensory identification, integration, information processing, and perception. So correct answer is sensory integration. Question number 79. All are seen in Hunter's syndrome except. Options are mutism, ptosis, meiosis, decreased sweating on opposite side of face. So correct answer is mutism. Question number 80. Decreased arm swing in case of Parkinson's disease is due to. Options are reduced arm strength, trunk muscle weakness, truncal rigidity, or decreased range of motion at shoulders. So correct option is truncal rigidity. So question number 81. Primitive grasp reflex disappears by the age of. So options are 0 to 1 month, 2 to 3 months, 4 to 5 months, 12 to 18 months. So correct option is 12 to 18 months. Question number 82. In Duchenne's muscular dystrophy, EMG pictures shows. Options are polyphasia, increased amplitude, short durations, large MUP with fast firing rate. So correct answer is polyphasia. Question number 83. The ability of the brain to change and adapt itself is called. So options are neural substitution, neural irradiation, neuroplasticity, and neural reinforcement. So correct answer is neuroplasticity. Question number 84. Scanning speech is characteristic of. So options are ACA infarct, anterior cerebral artery infarct, cerebellar disorder, Parkinson's disease, and cerebral palsy. So answer is B, cerebellar disorder. Question number 85. Approach gives emphasis on environment and musculoskeletal components. Options are motor relearning program, NDT, PNF, or sensory integration. So correct answer is motor relearning program. Question number 86. Unsticky phase of autogenic drainage involves following lung volume. Options are low lung volume, mid lung volume, high lung volume, and tidal volume. So correct answer is high lung volume. Question number 87. pump handle movement of thorax is a feature of? So options are lower ribs, upper ribs, mid ribs, and diaphragm. So correct answer is upper ribs. Question number 88. Mediastinal shift towards the affected side is seen in which of the following condition? Options are lung collapse, pleural effusion, pneumonia, and pneumothorax. So correct answer is lung collapse. Question number 89. PEP devices can be used in any position except one device that is position dependent. So options are a cappella, therapep, flutter, or cornet. So correct answer is flutter. Question number 90. Following acts as a pacemaker in the human heart. So options are SA node, AV node, bundle of His, Purkinje fibers. Correct answer is SA node. Question number 91. Which of the following AV blocks are considered as incomplete heart blocks? Options are only first degree, only second degree, first and second degree, first and third degree. So correct option is first and second degree. Question number 92. In metabolic acidosis, which of the following respiration is seen? So options are Biot's, kinestrokes, eupnea, and cosmoles. So correct answer is cosmol. Question number 93. As the respiratory rate increases, the inspiration to expiration ratio. So options are increases, decreases, remains same, can increase or decrease. So correct answer is remains same. Question number 94. Loud, high pitched, hollow quality, louder on expiration, distinct pause between inspiration and expiration are the characteristics of the dash breath sound. So options are bronchial, bronchovesicular, vesicular, and crackles. So correct answer is bronchial. Question number 95. How many centimeters above the sternal angle normally the jugular pulse is not visible when the individual is positioned at a 45-degree angle? Options are 1 centimeter, 2 centimeters, 5 centimeters, 7 centimeters. So correct answer is 1 centimeters. Question number 96. Cystocele involves prolapse of. So options are rectum, intestines, bladder, and vagina. So correct answer is bladder. Question number 97. The following is age-related change in the respiratory system. Options are decrease in pulmonary diffusion pressure, increase in the pulmonary arterial pressure, decrease in the airway resistance, increase in the diastolic blood pressure. So correct answer is increase in the pulmonary arterial pressure. Question number 98. Factors contributing to work-related cumulative trauma disorders are the following except. So options are nature of work, work posture, force application, work duration. So correct answer is force application. Question number 99. The energy system utilized in aerobic exercises is. So options are phosphocreatine, ATP, phosphorylation, and lactic acid. So correct answer is ATP. Question number 100. Early diagnosis and prompt treatment is a component of which rehabilitation domain? So options are primordial, primary, secondary, and tertiary. So correct answer is primary. So अगर आपको किसी भी क्वेश्चन में या क्वेश्चन के आंसर में डाउट है सो आप प्लीज़ कमेंट में ज़रूर लिखें अपना आंसर, ताकि बाकी लोगों को भी पता चल सके, क्योंकि हो सकता है कि आंसर कोई गलत हो या फिर आपको सही आंसर मिल जाए उस चीज़ का, बिकॉज़ ह्यूमंस से ही गलती होती है. अगर हम गलती नहीं करते तो हम रोबोट होते. सो जो भी रहेगा, डाउट भी रहेगा, तब भी आप कमेंट में ज़रूर बताइएगा। एंड अगर आपको कॉन्सेप्ट किसी क्वेश्चन का जानना है तब भी आप कमेंट सेक्शन में ज़रूर लिखें। ओके, एंड कोई भी डाउट है कोई भी टॉपिक से भी, तब भी आप कमेंट में लिख सकते हैं। सो थैंक यू सो मच फॉर वॉचिंग माई वीडियो एंड डोंट फॉरगेट टू सब्सक्राइब दिस चैनल एंड स्टे ट्यून फॉर more upcoming videos. Till then, take care. Bye bye.